Hi, we're sisters Brenda and Elaine.
Welcome to the Body Wealth Podcast, a space for conversations about the wealth that really matters.
Your best health.
Our guest, Lesleigh Mausi, visited many doctors and specialists before she was able to discover the cause of her severe facial pain.
In today's episode, we get to hear how she found the treatments that addressed her rare chronic disorder. Welcome to the Body Wealth Podcast.
You look great. I know you're not feeling great. How are you feeling?
I am experiencing a great deal of pain, but today is a lot better than yesterday. Yesterday I couldn't talk, couldn't eat. So today I have done both.
Yay.
And taking it slow. I've got my ice pack here, my little ice roller.
Well, we appreciate your being willing to join us even through all of that. For our listeners, would you just take a minute to tell them anything about yourself that you'd like to today?
Sure. My name is Lesleigh Mausi. I am an award-winning educator. I'm an author. I'm an entrepreneur of a concert promotions company here in North Carolina. I'm a wife, a mother, a sister. I am originally from Detroit, Michigan. I am a talker. I love to talk. So I appreciate you having me here to discuss this condition called trigeminal neuralgia, which hinders me from talking.
Let's get into it. In your late 30s, I believe, you began feeling pain in your jaw that felt like electric shock. Tell us about that pain and what did you do to try to figure out what was going on?
So when I started feeling the pain, it was, centered around this area here where the teeth are. And so, of course, you feel like, oh, I must have a dental issue. And I went to the dentist and they took x-rays. They said no teeth were rotting. They didn't think there were any cracks, but I insisted because of where, the pain was. Every time I would bite down and that electrical shock would surge through. So my dentist said, I will take your word for it. And he performed a root canal on my front right canine here. And during that root canal, I could feel the electrical shocks. And I kept saying, this isn't it. This isn't it.
Wow.
This isn't it. And I was saying it to myself during the procedure.
So when they gave you that dental anesthesia, you were still feeling the pain even with the anesthesia for the root canal?
I was still feeling it, right,
Wow.
which is why I kept saying to myself, this is not dental. This must not be dental. It must be something deeper underneath. So I was really disappointed. Like I advocated for myself and here it wasn't it, you know, so disappointed, but I have learned over the years that this condition is very difficult to diagnose. It is very, very rare. It is particularly rare among Black women. And so, Detroit is a predominantly Black city. My dentist didn't know anything about it. And, he was a trusted practitioner in what he does.
Right.
And so, part of me appreciates having a doctor who listened to me and when he said, I will take your word for it, and it was a procedure that was not life-threatening. I still have a beautiful smile.
But you wouldn't want to do that if you didn't have to, because a root canal is painful and nobody would choose to do it. So obviously you were in a lot of pain.
That's right. Absolutely.
And so how did you feel after, you went through that and you still had no relief?
Yeah, a bit defeated, a bit confused, because yet again, here I'm still in pain and I have elected to have this big procedure done, and that was the thing to do. It wasn't until I was home at my parents' in Ohio. It was a holiday, and I had a severe attack. This time, instead of just being along the jawline and the upper tooth line, I started to feel the pain behind my right eye.
Mm.
It would debilitate me so I would be down on all fours, just trying to, almost like I'm trying to hide my head. I don't know from what,
Protect.
but that was just that protect mode. They rushed me to the emergency room, and someone in triage, a nurse in triage, said, I think you really should see a neurologist. This is not something that we can treat here. It doesn't sound like it's dental. You need to see a neurologist. So I got back to North Carolina. We drove all the way
Mm.
in pain. I got right in with a neurologist, and they diagnosed me with trigeminal neuralgia after MRI and, a couple appointments. They finally diagnosed me. I felt relieved that it had a name.
No.
I can imagine. Thank goodness for that nurse, though, because, so often it's those experienced people on the front line
Right,
who see
right.
things and connect the dots.
You connected those dots. And like I said, I'd been in and out of emergency rooms. No one had connected the dots like she had.
Yeah.
And
So how many years had it been since you first started seeking medical relief for your pain?
if we count the dentist, that would be 2008. Um, I was seeing the oral maxillofacial doctors around 2010,
Mhm.
and then the neurology appointments began in 2011.
Wow.
So
Yeah,
3 years of on and off
that's
pain.
right.
Yeah.
Pain and not knowing what it was. And once we got a name for it, my mother got on that computer and started researching. Thank God for our mothers.
Yes.
Yes, yes.
She's also an educator. And she just got to researching and found that there was a trigeminal neuralgia center at Johns Hopkins Hospital
Mm-hmm.
in Baltimore. And so she told me about it. She said, you need to send your information and give them a call. I gave them a call. They requested my medical records and my MRI, and they invited me in for a consultation. And I'm sitting there, and in walks Dr. Ben Carson.
Mm.
I will be, consulting with you today. Let's talk about what's happening. Cool, calm, collected, very soft spoken, um, very formal, very
Mm.
formal.
Mm-hmm.
Uh, but he had a commanding presence. He was very knowledgeable, and he was patient. It's a very rare disease, so he took a lot of notes, or his assistant took a lot of notes, just very attentive. My mother was by my side, my husband was by my side. This was just for the consultation.
Mm-hmm.
And, and he said, you are the perfect candidate for our procedure, which is temporary. We don't have enough data to that informs us of how long your pain you will be pain free. This
Mm-hmm.
is not a cure, but you will be pain free as a result of this procedure. So it was great to meet him.
So after years of pain, some expert
hmm
is telling you, I have a procedure that can take your pain away. How quickly did you jump on that bandwagon and what was the procedure?
Oh, it wasn't even it wasn't even a discussion. It was, how soon can we do this?
Right.
Procedure was called a rhizotomy, and he explained that we would go through your cheek to the base of the trigeminal nerve, and we will inject a glycerin type of mixture that will coat and harden around the base of that nerve.
Mm.
So whatever is hitting up against that nerve, the nerve will be cushioned.
Mm-hmm.
It won't really make contact with the nerve anymore. And that is what was giving me those electrical shocks.
Mm-hmm. Well,
So
what
it
are the
wasn't
side effects?
The side effects were there was some numbness
Okay.
uh, on that side. It was not enough numbness to limit the mobility of my face. You couldn't tell anything from the outside. It is an important nerve from what I understand because I'm like, you can't just cut it out. I mean, do I need it? Yes, you do need it. If you didn't have it or if it was damaged, there could be paralysis,
Okay.
um, on that side of the face. So they went in and they injected that glycerin mixture, and it did what it needed to do. It gave
Dang.
10 years of pain-free relief. I'm so grateful.
Wow. So
Great.
your life went pretty much back to normal, back to
Oh
everything.
yeah.
You could do everything that you had ever done.
All the things. I was living life. I mean, living my best life, traveling, and I love to talk. Like I said, so I'm teaching. I am running 3 departments for this high school.
Mhm.
I was assistant principal of the year. I was just on. It was almost like full speed ahead for me.
Did you have in the back of your mind, knowing that it was temporary, that were you waiting for it to come back in a way?
At first, because I had been in pain for so long, so it was
Mhm.
almost too good to be true. It was almost like, let me not eat this or let me stop talking so much. But after a while,
Yeah.
I just leaned into it
Mm.
because I had missed being myself, freely being myself for so long. And I just figured, let me do me. Let me live this life. Let me show God how thankful I am. I didn't hold back at all.
Mm.
And it's interesting, November of 22, I started to feel a little glitch, a little zap,
Mm.
I'd say. And I hesitated. And I said, okay, well, no, no, maybe I just need to go for a massage.
Mm.
With massage, I'd say the next week I felt another little glitch, and I went into prayer. Like, Lord, what would you have me do? I had already put in a call to Johns Hopkins. I ended up meeting with Johns Hopkins in April of 2022. All of the research said that, people don't really get long lasting effects from the rhizotomy. They might get 6 years, they might get seven. The fact that I had 10, I was like, this is
That's
probably what it is. Yeah. So
Mhm.
went in and spoke with one of the neurologists there at Johns Hopkins, and they gave me a few choices for next steps. And one choice was a microvascular decompression surgery, which gives patients a 75% chance of trigeminal neuralgia not returning. And that was an option 10 years prior. But Dr. Carson said because I was a young mother, my children were young, he would prefer that I do the temporary surgery, which was much less invasive.
Mhm.
The microvascular decompression, and I'll call it MVD for short. The MVD um, is considered a brain surgery because they have to go in through your skull to get to the base of the trigeminal nerve.
Mhm.
What they do is they go in and they put small Teflon pillows around the trigeminal nerve to buffer whatever it is that's rubbing up against that nerve. I elected to have the MVD surgery, but I chose not to have it at um, Johns Hopkins because my insurance would not cover it.
Oof.
so. If your
So,
insurance would have covered it, would you have just done it
oh,
at Johns Hopkins?
in a heartbeat, in a heartbeat. And the reason why I didn't elect to have the rhizotomy again is because they felt that I may have gotten about 3 years
Mm.
worth of relief versus let's try this. It's really invasive, but you could walk away with, being pain free for the rest of your life. And so
Mm.
that's what it was.
So you were at a point in your life where you felt like you could go through it and the recovery would be something that wouldn't be too
Yeah,
stressful on your
for
family.
sure. Right. I was gonna turn 50, which is still young.
Mhm.
Um, my son was, going off to college, so that's both sons out of the house, and we're entering empty nester life. I just felt it was probably the perfect time to go ahead and do it, so that it was just less disruptions and probably more time that I could really be still and heal.
Mhm.
So that was why I said yes.
Your insurance changed from the first time because you moved or because you changed jobs
Right.
and
Education. I left education,
Oh, right.
and I went into our business full time. So we then um, got our insurance through the marketplace.
Right. Mhm.
And so that changed my coverage. And I could only go, certain places. Um, that my coverage is through UNC Chapel Hill Hospital. So that is where I went to see if there was a neurosurgeon who was well versed in trigeminal neuralgia, who had a great background. And that took some more research, it took more advocating for myself. And we found a doctor, Dr. Krishna, who knew of this condition and had done this procedure and had a good success rate with this procedure. If I had I not gone to UNC Chapel Hill to have this procedure done, this would have been an $80,000 procedure out of pocket at Johns Hopkins. So you can see
Wow. Yeah.
there weren't many doctors who could do this. So it was either him or maybe I take a loan out for this
Wow.
80K and go to Johns Hopkins. Either way it goes, I had to have it done.
so
Um,
when you met him for the first time, you liked him and you felt confident in what he would be able to do for you.
I did. He was very patient. He sat with me, much like Dr. Carson. He took time with me. He already knew the procedure. I did not know much about the procedure, so he did explain what it would entail. He went through my MRI film with me in his office to show me what he saw and what he would do. I appreciated how he had read through my history before I came to his appointment. He walked in and seemed to have familiarized himself. All doctors don't do that. You
Right.
would think
That's
they would, but they don't always do that.
So you're preparing yourself for surgery and you're preparing yourself for recovering from surgery and being away from work. Um, and it was a success.
Oh, yes, we believe it was a success. What I have learned since is that the recovery for MVD does not look the same as the recovery from the rhizotomy.
Okay.
After the rhizotomy, I was able to talk. I had absolutely no pain,
it was like an
um,
instant fix.
instant fix. But with the MVD procedure, I woke up and there was pain.
Mm.
Um, a week later, there was pain.
But is
And
that pain from the invasion of the surgery, like the cutting, or is that was it still the
this
same?
this was painful, this was tender, but it was still pain on the right side of my
Oh,
face.
shoot.
And I said, why did I do this? If I almost felt like I was sitting in that dental chair again.
Mm.
You know, hey,
No.
I went through all this and I still feel pain. And what my neurosurgeon explained was that the nerve has memory,
Mm.
and that he did was separate that nerve from the vein and the artery that was hitting up against it, but the nerve was still damaged. So that nerve, because whatever had been rubbing up and hitting up against it for all that time, it damaged the nerve. So the nerve had to heal and regenerate still on its own. So I'd still feel the pain, um, but I needed to be patient and let that nerve heal on its own. That has not been easy.
And so has it been 6 months? And it's still it's I can tell even just looking at you that you're still having pain. Is this in the time frame that your doctor still expected you to be having the nerve recover?
It is not. He asked me to give it 3 months and let's look at, what else could be going on. Now, I'll say I didn't stop living. I did relax and recover for 6 to 8, maybe 10 weeks. But then I turned 50 in October.
Mhm.
And my husband and I had planned, since before I started feeling this pain, we had planned to celebrate our 50th birthdays together in South Africa. So
Yeah.
I determined to go on that trip, come hell or high water, pain or no, we going on safari. So that's exactly what we did.
Oh, okay. One sentence on how the safari was.
Life changing,
Oh.
life changing. It was just the most thrilling experience that I've ever had,
Mm.
and the best food that I've ever had.
So was pain manageable during that time though, on that trip?
Ibuprofen 800 is not strong enough.
Wow.
I've been using and trying many, many different um, remedies. I don't want to have to use an opioid or something like that.
Now, do you think doctor prepared you enough for what was going to happen afterwards? For the he expected
No,
pain for 3 months. You said now, but did he tell you that before you had the surgery?
no, and that's interesting. He did not. And that could be for a few reasons, but I had gone in there advocating for myself with all this information and that I don't know, maybe he thought I was already knowledgeable. I
Mm.
didn't know the questions to ask.
Right.
Mm.
And that was something that needed to be disclosed to me. Um, so, part of the lesson for me was make sure you know the questions to ask before you go in. And what has since helped me with that is, joining some of these support groups and information groups for trigeminal neuralgia on Facebook
Mhm.
and on Instagram. And just, I mean, it's constant reading, it's constant familiarizing and keeping myself knowledgeable, reading other people's testimonies, some of the medicines that they're on, some of the treatments that have been successful for them. Unfortunately, this disorder affects everyone differently.
Mhm.
And as a Black woman, there aren't enough people on those sites that look like me, um, that can maybe share what they're going through.
So maybe there's someone else out there who can benefit from the research that you've already done. So you talked about, you didn't know what questions to ask when you were
Mm.
going into this second surgery. What do you wish you had asked?
I definitely wish that I had asked more information about that second rhizotomy. If I were to have gotten another rhizotomy
Mm.
versus D, I kind of felt like they shared more information about the MVD with me. Kind of painted the picture that I was a perfect candidate for it and it was a good time of my life. I agreed because that procedure had been mentioned to me back in 2012 by Dr. Carson, who said at that time I wasn't a good candidate. So it was always in the back of my
Mhm.
mind. But now I'm like, what could have happened had I gotten another rhizotomy? I
Mhm.
had already surpassed the data the first time with 10 years of pain free. Could I possibly have gone another 8 years?
Right.
And then is the rhizotomy, because it's less invasive, Is that something I can have over and over and over again? Is it always necessary to progress to the next more invasive procedure?
But
Right.
could you get another rhizotomy now?
So that's my next question. This doctor says no, not at this point. Where I am now in my journey with all of these doctors, he thinks that the procedure could was successful. He's wondering if what the pain I'm experiencing now is something different. That doctor yesterday has referred me to a facial pain specialist who I will see tomorrow. I mean, there's so many layers to this. I'll say it like that. There's so many
Mm,
layers, um, and I have to really be discerning and sensitive to what I'm feeling. This is an exercise in listening to my body,
mm-hmm.
because to feel and discern that the profile of the pain has changed from the electrical to now burning, throbbing. That is information that doctors need to know.
Yes.
If they go a different way, when you say things like that.
Yeah, and
So
communicating that is very important, but actually
very,
being able to discern it yourself first before you can communicate it is very key.
yes. And I am still going the holistic route. I guess holistic is how to put it. I've been seeing an acupuncturist.
Mm-hmm.
I go for to a physical therapist who does a particular massage. That has brought me some relief.
Oh, good.
Walking brings me some relief. Just trying to keep my baseline as healthy as it can be, because I'm on so many different medications.
You have had a lot of good family support through all this.
Mhm.
What kind of effect do you think, your being in pain and going through all this has had on your family, your husband, your sons?
Mhm. I will start with my sons because they have really never seen me slow down before. They were very young. They were much younger
Mm-hmm.
when I went to Johns Hopkins, and even then, I was back after a weekend, and you
Mm-hmm.
know, slowly getting into things at home, and I could still communicate. This time, I think it has made them nervous. And I have boys, so sons are very protective of their mothers, and I don't think that they were prepared. None of us, I'll put it that way, none of us were prepared for how down I have had to be. It
Mm.
sits you down. They're not used to seeing me in the bed,
Right.
like, so they call more,
Mm.
which
Always
I
good.
like.
Yes.
That's always a good thing. They call more. Um, and I think that it is teaching them to be in prayer,
Oh, okay.
for themselves. They're both away. And, they said, I'm praying, Mom, I'm praying for you. Well,
Um,
when they're praying on their own for their mama, and the things that they're saying back to me to keep me encouraged, they sound like me talking to them.
oh, that's
So
nice.
it is, yeah, I'm really blessed. And my husband, I tell you, he goes to every doctor's appointment with me. I am not sure that he knows what questions to ask, but he has a presence
Mm.
in there
Mm-hmm.
that says, "All right, now, what you gonna do, doc?" It's that presence.
I think it's good for the doctors to see someone's there looking out for you, that you are
Yeah.
Someone is there.
loved, and this is someone who is loved, and so we looking out for you. I think that's good.
Absolutely, absolutely.
Do you ever get down? Like, what effect does this have on your
Oh,
spirits and your mood and mental health?
yes, yes. When the pain is really, really bad, the past 2 days were difficult for me. Um, and, I go into that whole, God, just give me the answer. What's the answer?
Mm.
why am I having to live through this? What is the lesson? What, just tell me what the lesson is. I'll learn it, you know? I want to constantly be working towards healing. I don't want to wallow in the pain at all. But yeah, it can really pull you down. It really
Hmm.
can.
Do you have a therapist that you talk to?
I do. I have one. I have not met with him since I've had the surgery.
Mm. Why?
I have not. You know, there is no good reason why. He, I think in my mind, I've always compartmentalized him as, oh, if, communication's breaking down in my marriage, or if I'm feeling feelings of grief from losing my parents, or if, things like that.
Hmm.
You haven't
But I
saw him as a person who can address this for you.
have not. And I know that I can. I know that I can. So that is something that I am committing to doing.
Write it down on your to-do list right now. What I heard you talk about was external factors, right? Like we're going to
Yeah,
get help from a counselor or someone because this external factor. But when it's
right.
just my own mental well-being because of all
Mhm.
of this burden I'm carrying, sometimes we feel like, well, we just got to keep putting one foot in front of the other.
Exactly. Exactly. That's why, and you're, this is not the first time that someone has mentioned making an appointment with him. So this is confirmation, I need
Good.
to give him a call.
I feel like you are and should be still on a road to getting living a completely pain-free life. I mean,
Mhm.
do you feel that's still a possibility and something that you want to work towards?
Absolutely. Absolutely. I will be pain free.
Yes,
I
exactly.
will be.
Claim it.
Yes. Yes.
Hmm.
That is, it's going to happen. No weapon formed against me will prosper, not even this. And I am a believer. Let me trust God while we, apply this
Right.
science and find out what works, and go with that. I really believe um, that the answer is near.
Good,
I really do.
good.
Hmm.
Yeah.
We believe it too.
Thank.
Um, if there were another Black woman who just got diagnosed with trigeminal neuralgia
Mhm.
and she somehow was connected to you, what would you say to her?
I would say to her to read up as much as you can, um, and ask questions and advocate for yourself. Talk to them about what you really feel. Ask them to spend more time with you. Ask them if they have more than 20 minutes to spend with you. You really want to have a important conversation with them. Just don't take the 15 minutes that they try to give you.
Well, thank you so much. I
Oh,
appreciate your time and we appreciate your being willing to be a resource for others.
absolutely.
Okay, well, feel better, dear.
Thank you for having me.
It took a really long time for Leslie to get a diagnosis. She had an unnecessary root canal and several trips to the ER before someone suggested she see a neurologist who was finally able to diagnose her condition.
Yeah, it's really hard to make decisions about your medical care when you're in severe pain. I mean, you're desperate for relief and are not in a position to make the best decisions necessarily. So it's important to have support from a trusted medical provider and family member who can guide you and help you evaluate options so that you can make the best decision about getting the right treatment for your pain.
Thanks for listening. We hope this episode inspires you to increase your body wealth. If you like our show, please subscribe and tell a friend. For resources related to this topic, please see the show notes. And be sure to follow us on Instagram at Body Wealth Sisters.
The Body Wealth Podcast shares personal stories to inspire you. It does not constitute medical advice. For that, we encourage you to work with a trusted healthcare provider. We also want to remind you that the views expressed by our guests are their own. This podcast is dedicated to our mother, Jean Fernandez Barbour, who showed us what advocating for yourself really looks like.